Hello and welcome to page 27 of Anatomy Comic Book. This is Dr. Stephen Harkins. Lumbar, sacral, and coccygeal vertebra. We've already reviewed somewhat these, but we're going to take a closer look because it's important to know how these vertebrae articulate with one another and all the bumps and grooves and areas on the vertebra to know what you're feeling, what you're palpating, to know where the muscles attach and how, as I said, how the joints articulate with one another. So the lumbar vertebra is a little different than the thoracic vertebra. First, in that they have a very large vertebral body. The vertebral body is much larger and more substantial than a thoracic or cervical vertebra. It makes sense as it's in the lower part of the body. Greater weight bearing and also greater support for the larger muscles of the lower body. So the vertebral foramen, as we've talked about, obviously you know where that is. It's right here. It's this hole, foramen means hole, that the spinal cord can run through. And every vertebra has one, and the lumbar are no exception. So that is the vertebral foramen with runs all the way up and down, and when it's running up and down the spine, it's called the vertebral canal. The intervertebral foramen, we'll need to look at a side view for this, is right here. This arch of, say, L1 is the L1 vertebra, lumbar 1, and the superior arch of L2 form an intervertebral foramen. Inter meaning between, vertebral meaning the vertebra, and the foramen means hole. It's a hole between two vertebrae. Of course, the spinal nerve exits through there, so it would be right here, the intervertebral foramen. So you can see how a nerve might be able to pass through here and up the vertebral canal, or vertebra might be able to exit through the intervertebral foramina from the neurons come down, neurons come out, neurons come in, both sides, and then they go up to the brain. And of course, we have our intervertebral disc. That's this structure right here, the disc that's in between all of the vertebrae except C1 and C2. And the occiput, C1 does not have one either. These crisscross shapes makes it of the annulus fibrosus, creating strength in all directions for twisting and bending and rotating and stretching. So that's the intervertebral disc. Intervertebral, between the vertebrae. The disc between the vertebrae. Something interesting occurs in the differences between planes of the articular facets, how they lie, the planes of the articular facets. They sort of guide the motion in the spine. Look at the slant of the cervical facets here. Look how the angle is greater on the thoracic facets. It's more open. These facets are more closed off. Cervical facets, more acute, flatter, or more horizontal. And the thoracic facets, as you notice, are more vertical. And even more vertical are the lumbar facets. They're almost straight up and down. And something else to notice about them, here's the lumbar facet, is that the facets have now rotated. They're not, here's the anterior, and here's the posterior, the front and the back of the person. Notice how the cervical facets are facing, well, relatively backward, posterior. The thoracic facets are facing posterior. In truth, they face posterior and a little bit up towards you, a little lateral. And then notice how so it's the facet. Notice how the superior facet here, facet joint, faces inward. It faces this way. It faces medially, and the inferior facet of the one above faces outward, laterally. And so that affects the motion of the facet shape affects the motion. So plane of the cervical facets is angled off the horizontal about 30 degrees. So it gives it plenty of motion, especially in rotation. Lots of rotation around the cervical spine. The thoracic facets are arranged more vertically in the coronal plane, almost this way, up and down in the coronal plane. This is the anterior and the posterior. And the lumbar facets are in the sagittal plane. The sagittal plane. So if you look at the lumbar facets here, they would be like this, up and down here in the sagittal plane. One joint facing inward, one joint facing outward. Inward and outward in the sagittal plane. Facing medial, and one facing laterally, one facing medially, one facing laterally, and they join together. So it would look, here you go, here's a good look at it, the lumbar. Notice how the superior articular process is facing medially. Medially in the sagittal plane. And of course, that means the inferior articular process, let's make it a different color, why not? The inferior articular process faces which direction? Laterally in the sagittal plane. So that creates for a different type of motion, less rotation and more flexion and extension in the lumbar spine. And here you can see, sure enough, facing out towards you, towards us, towards the screen, or jumping out of the screen is inferior facet. Facing inward toward the screen is the superior facet of the one below. Facing out, facing in. Facing out laterally, facing medially. Laterally, facing medially. All in the sagittal plane. Now, as we get lower, there are some genetic sort of variants called tropism. Some of these lower facets do sometimes tend to twist and wind up in the more, if you'll notice here, more in the coronal plane. And allowing a little more rotation in the lower lumbar spine. And this could be the reason why there are more disc injuries in the lower lumbar spine, because the orientation of these facets allows for more rotation, which can put stress on that disc. When discs are rotated, they don't like to be rotated a whole lot. So there you have it. Now, the lumbar spine is really good at these two motions right here. Extension backwards, flexion forward, and that's because of the orientation of these facets right here in the sagittal plane. And there is some lateral flexion and a small amount of rotation as well. And continuing on, the pedicle, the bridge from the vertebral body to the articular process. The transverse process coming out the side, like the wings of the vertebrae almost. attachment for many muscles. Trunk muscles, they attach on the transverse process. The superior articular process here and of course the facet, the superior articular facet. The lamina, which brings the two sides of the vertebra together to form the spinous process. Here's the pedicle. With an inferior arch and a superior arch, pedicle, forming sort of the bridge of the intervertebral foramen there, as you can see. The articular processes, the superior articular process here, or where is it? Here, here, here. Big bump. Superior articular process. The inferior articular process, that's the one below here. It's hidden, it's sneaking in there. There you go. And the facet joint that's in between them. The spinous process in the back. These are the bumps you feel on the back of the spine. Now the sacrum. The sacrum, as we said before, was formerly used to be 5 separate vertebrae, but not anymore. But it does, it's fused into one piece, but it kept its vertebral foramen, the vertebral canal. It still does run through the hollow part of the tailbone, the sacrum. Let's outline it. The superior articular facet of S1. Call it S1 because remember, once upon a time, this vertebra, S1, used to be a vertebrae. And you can almost see the transverse process here. Wings, you see. This would have been the pedicle in here, probably. You know, oh, no, that would have been the lamina. The pedicle would have been right here. Here. And so you can see the different, how this used to be a vertebra segment. And here would have been S2, S3, 4, and S5. And so these are the posterior sacral foramen. These were the nerves come out, the sacral nerves exit. And also on the front, the anterior sacral foramen, the nerves come out of. Of course, it's got this triangular shape to it. The superior articulating processes for what? Here it is right here. Superior articulating process for L5. For the inferior process of L5 to articulate and form a joint. Sacroiliac joint here, or the articulating surface for the sacroiliac joint, where the ilium comes and articulates. The auricular surface, they call it. Why? Auricle means ear. It's got the shape kind of an ear, right? And with this triangular shape, you can see how the ilium, which is out here, forms kind of a keystone effect. So the weight of the body can be distributed, the force can be distributed sort of down and laterally out to the femur joint, the legs. And it fits in there nice and snug like a keystone. Here again is the auricular surface of the sacrum attached to the ilium and the sacroiliac joint, the SI, sacroiliac joint. Here's a lateral look of the canal. the vertebral canal, the sacral canal in this area here. Spinal cord runs all the way through there. Not the spinal cord anymore, let's say nerve, the sacral nerves. And you can see remnants here of S1, remnants of S2, body of S2, S3, S4, S5, but they've been ossified, right? I should say the discs between them have been ossified. Here are sort of the ruminant leftover disc material that turned hard and calcified and turned into bone. But you can certainly see, so this is a slice. It's sliced right through the middle of the sacrum. And here's the ruminant, or the disc that was left over. And then, of course, we have the coccyx down here. And its little 4 little segments, 1, 2, 3, and 4. Interestingly, you can also see the bumps on the back of the sacrum that obviously used to be the spinous process. And that represents page 27 of Anatomy Coloring Book. This is Dr. Stephen Harkin.